We're now discussing cardiovascular section, in particular endocarditis. Endocarditis is inflammation of the endocardium. Remember, on the heart there is the endocardium, which is the part that's touching the blood. Then there's the myocardium, which is the muscle. And then there's the pericardium, which is on the outside, kind of facing the body. So endocarditis is usually caused by a bacterial infection. And we're going to be covering several different types of bacteria that do this and conditions surrounding them and ways to memorize them as well. So first of all, we have Streptococcus viridans. So Streptococcus viridans, that's the most common cause of endocarditis. Typically what happens is apparently it usually is carried in the mouth, and so you'll have some kind, it's a dental caries, they pronounced it. So you'll do surgery on somebody's mouth, like maybe a dental procedure, and then it'll get into the blood, and it'll travel through the blood down to the heart, and there it'll get on the valves of the heart, which are covered in endocardium, and then those will become inflamed. And it's not extremely virulent. It doesn't go real deep. It's kind of a shallow sort of infection, and it actually will only infect people if they already have damaged valves. If their endocardium is already damaged in their heart, it'll only attack that because it's not very high virulence. And when it does infect, it only has small vegetations. It doesn't actually destroy the valve, but it makes, there was some collagen and fibrin, whatever, sticking out, it may create some thrombotic vegetations. So let's talk a little bit about Streptococcus viridans. It's gram-positive. It is, now of course, in the name Streptococcus, so obviously it's a cocci. Cocci means it's coccus. It's a circular in shape, okay, coccus. Gram-positive means that it stains purple, okay, crystal violet, whatever, on a gram stain, which means that it does have a peptidoglycan, a thick peptidoglycan cell wall, and it's catalase negative, so the enzyme catalase doesn't have that. It is alpha hemolytic. It is optochin resistant. It is not bile soluble, so it does not, solubilize or whatever the word is in bile. It has, and everything else I pretty much talked about already. So how can you remember these things? I thought of Streptococcus viridans. I drew a picture of the vampire Dan. So here's Vampire Dan. Probably should have drawn him as a stripper or something like that. For Streptococcus, stripper, kind of sounds like stripper. So here's Streptococcus viridans. And some way to remember this is the cocci. Of course, it is in the name, but he's got cocked eyes. Alpha hemolytic. I drew some blood coming out of him with an A on his shoulder. So the blood's coming out hitting an A for alpha hemolytic. He's wearing a cross to remember the positive sign, the gram-positive. His optochin resistant, so here he has this toe on his chin. Remember the optochin resistant. Dental caries, remember he's got the big scary looking teeth because he's a vampire. No bile, he's barfing out bile because he's not bile soluble, he doesn't like it, barfs it out. Yeah, so there's some ways to remember. Notice there's no cat in this picture because it's catalase negative, so there's no cat. So next one, Staphylococcus aureus. So Staphylococcus aureus is the most common cause in IV drug use. And this is basically what happens. So you've got an IV drug user. They're dirty. They've got staph all over their skin. Staphylococcus aureus all over their skin. And then they take a needle and they, through their dirty skin, because they don't do an iodine swab or anything first, through their dirty skin they push that Staphylococcus epidermidis through their skin and into their blood vessel in order to get drugs. So now this Staph aureus goes into their blood, travels around their blood, eventually makes its way to their heart, to the tricuspid valve, because they wanted to try some drugs, so now that's going to their tricuspid valve. And if you remember, tricuspid valve is the valve between on the it goes TPMA, so the tricuspid valve is between the right atrium and the right ventricle. Okay, so it's between those two. So it does infect, unlike this one, that the Streptococcus viridans only infected damaged valves. Streptococcus aureus has very high virulence. It will infect healthy valves. So it doesn't have to be damaged for this thing to really get in there and hurt people. Staph infections are bad. And it causes large vegetations. This one had small vegetations. This one's big. And you look at this, you see Streptococcus is like a strip of cocci. Whereas if you look at, if you look over here at a staph infection, it's a big cluster. Like a cluster of grapes, it's a staph infection, Staphylococcus aureus. So that's another way to think of that. And so for this image, I created an image to try to help you remember it. But here are the things about it. It's gram-positive, it's a cocci, catalase positive, coagulase positive, beta hemolytic, that's the bad one. Protein A virulence, inhibits phagocytosis. It's involved in methicillin-resistant Staphylococcus aureus, or MRSA, that's the one you're thinking of here. In other words, it's resistant to methicillin, which is a penicillin drug. Resistant to beta-lactams by altered penicillin binding proteins. So it has altered its penicillin binding proteins, and that's how it's resistant to methicillin, which is a penicillin drug. So in order to remember this, I drew a silly picture over here. This cat right here, his name is Mr. Saw, helping remember MRSA, Mr. Saw. This cat was thinking of eating his protein, his chicken leg with an A on it, but instead he decided to eat an entire staph of Oreos. So here's his staph aureus. This is protein A virulence. He's going to eat that. He told me protein A, but instead he's eating the staph of Oreos. And he put a big mark on top of it to remember that's, I don't know, it's got a gram-positive on top there, okay? And it's beta hemolytic. I drew some blood dripping from the cross on top. But it's not any ordinary blood. It's beta fish blood. And they're coagulating into this big thing here to help you remember it's coagulase positive. I don't know if that'll help at all, but there it is. Now let's go to staph epidermidis. Staph epidermidis, of course, epidermis is skin. So the deal with this is that what happens is when people get like prosthetic valves or, you know, any tubes or things put in them, what ends up happening is that they call this the endocarditis of prosthetic valves. So essentially, it gets from the prosthetic valves, or whatever, it gets into your blood, and I don't know. So it's cocci, gram-positive, component of normal skin flora. It has adherent biofilms. So it produces this kind of sticky biofilm that it can stick to things. It's catalase positive, but this one's coagulase negative. Okay, coagulase negative. This one's Staph aureus is coagulase positive. This one's coagulase negative. This, and then Staph viridans was catalase negative. So catalase negative, catalase and coagulase positive. And now we have catalase positive, coagulase negative. And also it's novobiosin sensitive. So how can you remember this? Thought about this guy here. He's the epidermis man. He's made out of skin. He killed this cat. That's why the cat has X's for eyes, because it's catalase negative. But he realized that was a biosin, novobiosin. Remember, it's novobiosin sensitive. So he became sensitive to that, started crying. And so yeah, we got the catalase positive, the novobiosin sensitive, cocci, his eyes are cocked, normal flora, he's got a flower on his head, he's got a cross around his neck to help you remember it's gram-positive, and staph epidermidis, so staph epidermis man. And he doesn't have any blood at all. He just has a sticky biofilm. Okay, I don't know. So there it is. And then lastly, remembering S. bovis, which is associated with colorectal cancer. So if a person, you find they have S. bovis, check them for colorectal cancer because there's a strong correlation there.